Hey everybody, this is Stacy with Spectrum the Other Clinic. I always say it's a short video that I'm popping on here for. I have high hopes that it's short, but who knows. Anyways, so this is more geared toward the feminizing individuals, mostly toward like the ones who are doing like full transitioning toward feminization and whatnot. You know, the whole shebang, boobs, butt, thighs, you know, all that stuff. Because I keep getting these like panic-stricken questions like all the time, myself and Lee here at the clinic. So people are really obsessed with their numbers, meaning their blood levels and everything. And secondarily, they're obsessed with their doses and things. I know that part of this is going to be because of the gatekeeping nature of healthcare providers traditionally towards trans people. We don't do that crap here. We just are here to answer your questions and help you get the best transition possible, as safe as possible as well. But I get it that, you know, you don't really have a history of getting great help and great answers from healthcare people. So whenever you see this crap online where people are saying, oh my God, you know, your level is only XYZ, Jesus, how are you ever going to get anything done? Or you're only on this? That's the worst. Don't they even care about you? This is complete crap, and it's just like this cyclical shit cycle, basically, where you're just gonna freak yourself out. And I find that like a lot of people out there who are doing their little YouTube videos or, you know, chatting away on Reddit, they tend to be shit stirrers is basically it. They like to get reactions from people. They're looking for likes and clicks and subscribes and watches and all that crap that they do online nowadays. It feels so old. But anyway, you know, they don't know you. For one, they're not treating you. For another, they are, God only knows who they are. They say that they're, you know, some expert behind the scenes, or that they've, you know, done XYZ, or that they've read all this. People lie. I hate to break it to you, but people lie all the time to make themselves feel better or to feel like they're helping. You know, they may be coming from a place of positivity. Who knows? But a lot of people are also shit stirrers, and they just like to get reactions. So this is something very common that I see more so with my full feminization patients than I do with literally any other folks out there. And I think it's just because y'all are judged more harshly by society, which is complete shit, yeah, but it doesn't, you know, just knowing that doesn't stop it from happening. But I I really would like to kind of ease your mind by, one, discussing levels and how they apply to transition and everything, and why you shouldn't be so overly stressed about this stuff. So a couple of myths that are out there are, you know, that transitioning is quick. That's not a thing with feminizing therapy. Like, I don't know who put that crap out there, but they're full of complete asinine dog shit. So feminizing therapy, bare minimum, is going to take 3 to 5 years and probably longer. I mean, this is puberty. This is the body with a cellular development process. You can't keep up fast change. It's impossible. The only kind of like thing in the body that can keep up such fast cellular development as what some of these idiots online are talking about is like a tumor. So you're not going to see like breasts erupt from your chest in 1 month. Like, that's not a thing. Like, you don't get a full rack in like 2-3 months or something like that. There's these crazy people out there. You know, if you get breasts that quick, you had surgery. I don't know what to say. Now, you may have growth spurts. That is true. You may have some growth spurts where for a couple of months, like, things are just rapidly changing. And usually that's going to be sometime during your first year of hormone therapy, because your levels are going all over the place. Your body's adjusting. You hit that spurt. But as I mentioned, the body can't keep up that level of change that fast for so long unless the growth is a tumor. Again, I'm going to say tumor at least 3 more times. Maybe not. I'll stay away. Anyways. So I find that we are judging ourselves against other people's standards, and these other people, who the hell are they? Like, anyways, so when it comes to trusting other people on the internet, and this is coming from someone who's also on the internet, but you can actually look me up, Stacy Pace, nurse practitioner in Mississippi, and find out that I have an actual license in this state to be doing this crap. But anyways, so I do know a thing or two here. I do have some credentials and studying and practice and experience and stuff in this, to be able to say that feminizing therapy takes several years. You're not going to change overnight. You're not going to change in a week. You're not going to change in a month. Things will slowly progress. You will have growth spurts, and then you'll have what feels like regressions, but in reality it's just that everything's slowed down to a normal pace of change and growth in the body, and that can feel like you're not going very fast anymore. I mean, have you ever been driving along at 70 miles an hour on the interstate, and then somebody gets in front of you who's doing like 55 miles an hour is still pretty fast, right? But sure doesn't feel like that whenever they pull in front of you and you were doing 70. Kind of the same concept, those spurts are fun, but they can't last. They just can't. The body can't support that. Anyways, on to the levels, since I've already talked for 6 minutes about all other kinds of things. So in regards to estradiol therapy, of course, we shoot for suppressing testosterone. At my own clinic, we look to suppress testosterone by getting your estradiol levels up high enough to cause the body to shut down its own production of testosterone so that we don't have to use testosterone blockers. It's a very neat process. I have a whole other separate video about that if you'd like to check it out. But anyway, essentially what we shoot for initially, and depending on goals and age and everything, keep in mind all these numbers I will say are just kind of like averages and everything. Everybody's different. We usually shoot first to get your testosterone levels down to about 50 or less. Some people just 100 or less, depending on their sexual goals and whatnot, of what they want their function in the downstairs area to be able to do. But initially, we usually shoot for 50 or less or so of testosterone, total testosterone, that is. After that, then estradiol becomes the next step. So first step for me anyway is dropping that T level with high levels of estradiol, and then following up on what are these estradiol levels. So once you've dropped your T, just about any level of estradiol is going to cause feminizing effects over time. This is a thing that for some reason people just go nuts over. Somebody will be like, oh no, my estradiol level was 100. That's it. My friend was 220 or whatever. Okay, a lot of factors at play there. Number one, if your estradiol level is 40 or 50 or higher, with your testosterone being below 50, you will transition slowly over time. Now, those levels are not what I prefer to put people at, but I'm just saying that so that, people will know it's not that you won't transition with lower levels of estradiol. It's just that it may take a lot longer than somewhat higher, or at least that's the way it appears. I know there's people who have views different ways. In my own practice and what I've seen, I like to take people to a level of somewhere around 200. That's plus or minus a lot though, because I've had people that they get a level of 100, they do fine. I've had people that needed more close to 300, and they do fine. What you don't really want to do is go over about 600 or so consistently, because if you consistently go over 600 for a period of time, sometimes days, sometimes weeks, it can cause an opposite and quite unwanted effect in the body, where your body begins to produce these androgen precursors that are just like testosterone. They cause the same effects as testosterone, essentially. Not a lot of fun. So you got to find that sweet spot in the middle. High enough to cause changes, but low enough not to cause that androgen production to kick on. And also, the higher and higher you go, the more risk of inflammation type products such as clots and strokes and stuff like that. So that's why we want to keep it in that sweet spot. The sweet spot for me, depending on the type of therapy you're on, like pills, injections, and whatever, and the timing of when the labs are drawn, is going to be somewhere between 200 to 500, and that's plus or minus, 100 really. But 200 to 500 is about my sweet spot that I find for most individuals. Now, depending on your age and your overall health and what other medicines you're on and what other kind of chronic conditions you have, you may have to have somewhat more on the lower end, like 100 to 200, to maintain, a better safety profile, depending, like I said, on your health and conditions and medicines and stuff like that and age. But you will still transition, just, perhaps if that wasn't quite the sweet spot for you, then it might be a little bit slower of a process. But anywho, so back to the levels here. So first important thing, knock that testosterone down with some high estrogen levels, or if your provider is doing testosterone blockers, then whatever. Long as you knock that T level down below 50, just about any E level is going to start your process going. Even if your E is almost nothing, like 20, you will slowly demasculinize, so to speak. You may not get much breast tissue and fat redistribution, but you will slowly lose muscle mass and stuff if all you do is drop your T. Now, you might also feel kind of crappy too, because if you don't replace the T with E, you can feel kind of wonky. But anyway, so then estradiol comes into play after dropping that T. And like I said, my sweet spot is 200 to 500, but what exactly does that mean? Does that mean that whenever I draw your labs, if it says, I don't know, 80, does that mean the end of the world? No, it depends on what kind of medicine and everything you're on. So here's an example. Pills at my clinic, I usually, if someone's doing full feminization, I start them off on 2 milligrams 3 times a day under the tongue, because if you dissolve it under the tongue a little bit before you swallow it, you will absorb about 20 to 30% more of that medicine than if you had just swallowed it whole. And that's because the liver kind of destroys a lot of that pill if you just swallow it outright. Putting it under the tongue or between the cheek and gum is going to cause you to absorb more of it directly into the bloodstream and avoid that first pass through the liver. So you absorb more medicine. Cool. Anyways, so 3 times a day under the tongue or between the cheek and gum is what I start people off on estradiol therapy. That does it actually for a lot of people, most people in fact. Sometimes we do have to go up on how many tablets you're taking and everything, but most people, that does it. That suppresses their testosterone levels, that gets their estradiol levels up high enough for them to start making changes. It's great. But whenever we come to draw their levels, timing is very important, because let's say you've been on that 3 times a day, 2 milligram pill under the tongue for several weeks now, 2 to 3 months, and we're rechecking your levels. What I'm going to tell you is you're going to take your 3 pills the day before, and then you're going to get your labs drawn first thing the next day before you take your first pill of the day. So you're going to hold your medicine that next day until you get your labs drawn. The reasoning for this is that if you've been on these pills for several weeks, a couple of months or whatever, and we get your labs drawn within just a couple of hours after taking a pill, really and truly, the levels will be so high, all it tells me is that you're taking your pills. It doesn't tell me are the pills lasting. Pills a lot of times have a very short half-life. It's 6 to 8 hours max of the strength behind these pills, and then they rapidly taper off. And so what I'm looking for here is whenever we're drawing your labs, I would like for you to have taken your pill, their last pill the last night, and then we draw it at 8 to 10 o'clock the next morning. So let's give an example. You took your last pill at 10 o'clock last night. You get your labs drawn between 8 and 10 the next morning. So that's between 10 and 12 hours later. What I would expect your level with pills to be 10 to 12 hours later is probably somewhere between 80 and 200-ish. What commonly happens, though, is that people sleep later and they don't go and get their labs drawn that early in the morning. So let's say you took your last pill at 10 o'clock that night. You didn't get up till 10 o'clock the next morning, and so then you didn't get your labs drawn till 1 o'clock in the afternoon. Now we're talking, what is that? 12, 13, 14. So that's 15 hours after your last pill was taken. Now, we should expect that pill level, the level of estradiol in your blood is going to be much lower than had you had it drawn at 8 o'clock. Keep in mind, again, the half-life of these pills, the strength of them lasts for about 6 to 8 hours, and now we're checking you almost 16 hours later, 15 hours later, so your levels will be lower. Your levels at that point are probably going to be, 40 to 80 maybe. They may be higher. Some people hold on to this stuff better than others, but it wouldn't surprise me to have a 60 or something like that long after. That's why it's very important to take these pills multiple times a day rather than just once a day. If you take it once a day, then you have great levels for 6 to 8 hours, and then kind of hours for another 6 to 8 hours after that, and then it's kind of like meh for the rest of the time until you take your pill load the next day. So anyways, so if you took your labs, say right after you took that pill, like an hour, hour and a half after, you would see levels anywhere between 400 to 1,000, 1 to 2 hours after that pill has dissolved in your mouth. That is how high pills can take you at their peak. 400 to 1,000. Depends on the individual. But that's pretty high. And then over the course, like I said, of like 8 to 12 hours here, when we would draw labs normally later, that's why I expect to see that we would have had this height, and then they come slowly down over toward the next morning. You draw it at 8 o'clock in the morning, just 10 hours later, and I would expect it to have dropped to maybe 80 to 200 or so by that point, depending on how high it started up. And that's why I want to know, are they lasting? Because if we check it and your level is 20 and you took your last pill at 10 o'clock at night, those pills aren't lasting very well. So you might either need to take it later, double up, take a double tab at night to really give you a boost, or change the method that you're doing to patches, injectables, cream, or something like that to get a better last out of these things. So anyway, pills are the more difficult ones to track their levels and stuff because they're just so erratic, and that's why a lot of people, they go on pills. I mean, think about it. If an hour after you take your pill, you have 400 to 1,000 potentially of your estradiol level, that's nuts. And then you're dropping down all the way to maybe 50 to 80, 12 hours later. Yeah, and you're doing that 3 times a day. Who has mood swings? Why? I don't know. Anyways, so yeah, pills can be kind of a roller coaster ride, especially whenever you first start taking them, if you're taking them appropriately, 3 times a day, under the tongue or between the cheek and gum. If you're doing like a lot of prescribers for whatever reason do and have you take them once a day, you will, like I said, you'll have that extreme boost that first 6 to 8 hours, and then afterwards it's going to kind of rapidly taper off to where you may feel tired at the end of the day, honestly, because your hormone levels are going to be trash by the afternoon, evening. This is another reason 3 times a day is really great, so it can keep your hormones up, keeps your energy levels up. It just kind of sucks that you have this roller coaster of estradiol levels up and down, but that will get the juices going and get the changes going. Now, over on to patches. Patches produce a pretty stable level of hormones. I like to get them checked on day number 2 of a patch. It's just ideal because it's usually still sticking really good. It's in your system really good. It's just my favorite day. My second favorite day is the first day, at least a few hours after patch application. Like, don't just slap it on and then go get stuff drawn. Like, give it time to start, putting back out and everything. But then my least favorite days would be the 3rd and, that one patch. If you do patches twice weekly, there's always that one patch that has a 4th day. Your levels do tend to drop off from what they used to be on that 4th day. That one day a week, you might have lower levels than you would the first 3 days of a patch. If you have the once weekly patch, then that drop off starts happening on that 6th day and is more pronounced on the 7th day. I still prefer the 2nd day, even on a weekly patch, to see what people's levels are. And my second favorite day on a weekly patch would be the 3rd day. But anyways, those produce levels at the 0.1 milligram patch dose, the highest dose patch that we have here anyway. Those usually produce, if you're absorbing it correctly, because that's a big problem. A lot of people don't absorb patches very well. They get a rash or they just, whatever. If you're absorbing them well, then that high dose patch usually, and most people, produces levels somewhere between 80 and 250. I have seen people go into the 300s. I've also seen people who don't absorb at all, and it's as if they haven't been wearing anything. Or it's just kind of pitiful. It's like 40. Which, like I said, as long as your testosterone level is suppressed, that will produce slow changes over time. It's just that it'll be slow. Or slower than perhaps if you had some higher levels. With regards to injections, Most injections get done, at least at our clinic, we start people off at injections once weekly, sometimes every 5 days. Sometimes we do microdosing where you do a shot either every third day or every other day, something like that. It kind of depends, but let's say if you were doing once weekly injections, then my favorite days to get labs drawn are days 5 through 7 after your most recent shot was given, so that we see the lowest level of estradiol in your system. And what I'm shooting for there, if it's on days 5 to 7, is to see a level somewhere between maybe 150 to 300-ish, depending on the day. Was it day 5, 6, or 7? If you give me a 150 level like an hour before you're supposed to take your very next shot for the next week, great. Whatever. If it's 200, that's fine. If it's 300, I'll still take it. The very beginning of your injection cycle, like 1 day or 2 days after you've taken your shot, though, the reason I don't really get peak levels is because it doesn't give me enough information. It doesn't tell me how long this stuff is lasting in your system. It tells me that you're on your shot. Okay, that's great. I already know you're going to be on your shot. Who the hell would come and see me and pay to see me and then pick up their script and never take their medicine? That sucks. Anyways, but 1 to 2 days after you take your injection, your estradiol levels could range anywhere from 400 to 800 or so, depending on the person, the dose, and all that stuff. But those levels will then slowly trend down over the course of the week. So rather than like pills where it's going up and down 3 times a day, you start high and you end up on the lower range, but over the course of a week, so there's not such rapid change. That being said, like I said, whenever you hear someone online from here on out telling you, my level's 800, your level was only 200, you'll never make it. What dose are you on? When were those labs drawn? Are you a crazy person? Always ask yourself, could they be a crazy person? Because, like I said, a lot of these people sensationalize. Oh, and another thing, people have different measurement scales. They could be, what is it? What do they use in Europe? I forget. There's like PMOL and whatever, and ours that I typically use is like PGML. So, they could be talking about a different unit of measurement entirely that you're misunderstanding and thinking, is something that applies to you, and it really needs to be converted to the units that your lab is using to even understand and compare. But again, they could have different health, different age, different medications that they're on regularly, different chronic conditions. They could have different goals than you. They could have the crazy factor. Anyway, so there's so many things that go into this. And when were the labs drawn? When they, after they took whatever medicine version that they're on? Do they have a competent prescriber? Because there's an awful lot of prescribers out there who I hope mean well, but prescribe really strange stuff. Like I mentioned some point earlier, if you keep estradiol levels up too high for too long, they can kick on that androgen production thing, and then folks will write in and be like, hey, my provider's got me on this and my level is whatever, estradiol's 900 in mid-cycle range after I did my injection, and my facial hair and stuff has been growing back so much faster than it used to, or I've been getting morning stuff going on every morning that didn't used to happen. That could be symptoms of that happening. Your libido suddenly comes back. Yeah, that could be a symptom that you've got other androgens or masculine hormones floating around in your system because of that elevated estradiol level kicking on that process in the body. Anyways, so those are the general levels. Like I said, they're not hard and fast levels, though. So many factors go into it. Please quit judging yourself against other people. These folks they're those what are they, the frenemies? Yeah, what all the young folks calling them nowadays. I'm turning 40 this year, y'all. Anyway, so I get to claim the slightly aged factor and wisdom. No, but these people don't know you. They don't have your best interest in mind. They're going to have their own agenda for doing whatever they're doing. If you have a question, Ask your healthcare provider. If your healthcare provider is a dick, you can always write into us. We'll try and answer your questions, whatever you write in. Just, I know there's good information on the internet, but there's also very, very bad information out there. Please stop panicking yourself about all the things that you see out there. There is so much more involved in feminizing therapy than just there has to be this one level or else you fail and you will never, transition. Oh, and that's another thing, just off the top of my head, I get a lot of folks that they have started therapy somewhere else and they come to us, or we started out on pills and the pills really just weren't quite doing it for them. And so like 3 or 4 months in, we decide to change. And then the question I get from these people who either they changed from some other clinic to ours, and we changed up their regimen because when we checked their labs, it just wasn't ideal, or they're with us and we decide, let's change something. People are worried that they have wasted their time or that they have missed the boat and they will just, oh well, no transition for you. You spent 2 years at that other clinic with this low dose estrogen bullshit and your levels were only 40 and blah, whatever. No. All hope is not lost, people. You will transition. It's fine. Like, there are some people out there that think that you just can't transition past a certain age. That's complete shit. You can transition at any age. Our oldest patient right now is 78. Get over that. Now, that being said, yes, it is easier to transition the younger you are because your body has just a better capacity for cellular reproduction and healing and all that crap. But to think that 1 or 2 years or something goes by, or even 15. I've had a patient come and they were at someone else's clinic for 15 years and they had had low estrogen levels forever. Their T was dropped, but their estrogen levels were kept at postmenopausal cisgender woman ranges forever. They felt like crap. They had transitioned some. They were very feminine appearing, but they were just not happy. Guess what? We get them on a new regimen. They felt amazing. They saw some additional changes happen. Perfectly fine. It's never too late. You're not going to kill your transition off if you didn't start off with perfection. There is always change that you can do. It is fine. Stop freaking out, folks. I know it's hard. I know. Healthcare providers are dicks. I know. I am one, and I'm a dick half the time too. But anyways, so if you have questions, like I said, write in. We are quite busy most of the time, so I'm sorry if we don't respond very quickly. But if you don't feel like you can talk to your own healthcare provider, we are open for questions. Of course, we can't give personalized medical advice, and all of this video should not be construed as medical advice either, but stay safe, folks. Stop beating yourself up over some idiot on the internet thinking that they're better than you. They're not. You are uniquely you. Your transition process is yours alone. Your goals and everything are yours. Stop. Take a deep breath. You're going to be fine. All right? Love y'all.